There are 3 toxic drug levels that you have to know for NCLEX: digoxin, theophylline, and lithium. You also have to know the signs and symptoms of toxicity for those drugs. If you don't know those, you might want to watch this video coming right up. Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews. Today, we're going to continue our walk through the Blue Book, again, focusing on pharmacology, and we're going to be talking about drug toxicities. This is found in pages 109 and 110 of the Blue Book, I think either 108 and 109 or 109 and 110. You can see the Blue Book right there behind me. You can order it from Amazon if you're in North America. And if you're not in North America and you want to order it, well, you can't order it, but you can purchase the Blue Book app from Clinic Reviews. So if you go to clinicreviews.com, you can actually purchase the Blue Book app. That doesn't have the page numbers, but it does have all the content and you'll be able to go through it. Now, remember, the Blue Book is focusing on facts. It's facts that you have to know. I've turned these facts into classic NCLEX style questions, so we're going to go through it that way. However, these are not particularly difficult questions from a standpoint of clinical reasoning. These are going to be questions that if you know the fact, you're going to get it right. Okay. And you can get questions like this. They're the lower level of NCLEX style. You're probably going to get these types of questions earlier on in the NCLEX. So they'll start out at the lower level, kind of this application style question, and they move on up until they get to the clinical reasoning style questions where you have to do things like prioritize, who you're going to see first, what's your best action, that kind of thing. That's clinical reasoning. These are application. Do you know the fact and can you apply it in the right situation? So that's what we're going to be focusing on here. And I'm going to be teaching you this content using these questions. If you get the Blue Book yourself, and I do recommend it, you can just study these facts and then you can watch these videos to see how they could be used in a question. All right, a patient with a history of heart failure is taking digoxin, which is lanoxin. The nurse knows that which of the following symptoms might indicate digitalis toxicity: yellow or green vision, increased appetite, weight gain, or hyperactivity. Y'all, everybody knows yellow and green vision or yellow-green halos around things is an indication of dig toxicity. I figured everybody knew it, but just in case you don't know it, you do not want to be the only one that doesn't know that fact. Okay, so make sure that you know that fact. That is a symptom of dig toxicity. A nurse is reviewing lab results for a patient on digoxin therapy. Which digoxin level would the nurse interpret as toxic? So toxic dig is 2 or higher. 2 or higher, all right? 2.5 is clearly above 2. So anything below 2, y'all, is not toxic. Anything above 2 is considered toxic. For dig, a patient taking dig presents to the ED with nausea, vomiting, and confusion. Based on these symptoms, which lab value will the nurse expect to be ordered? Potassium level, magnesium level, dig level, or B-type natriuretic peptide? So lanoxin, digoxin, is a cardiac glycoside. Cardiac glycosides increase the strength of contraction. So people with heart failure take digoxin. It also slows heart rate. So when you get a question where someone comes in on a med and they have these specific symptoms, even though you might go, well, B-type natriuretic peptide will tell me if they're in heart failure. That's true, it will, but these symptoms are not consistent with heart failure symptoms. These symptoms are consistent with dig toxicity. Yes, I know everybody knows green, yellow halos around the eyes are dig toxicity, but did you know that the earliest signs of dig toxicity are nausea, vomiting, and headache? So we don't have headache in there, but I'm just telling you, nausea, vomiting, and headache are the earliest signs of dig toxicity. So we want to draw a dig level. If they're not toxic, of course, we can go on and start checking other things. But initially, what do we want to do? We got to check that dig level because these are actually the earliest signs of dig toxicity. Question 4, a patient with bipolar disorder is on lithium. The nurse knows that which of the following symptoms might indicate lithium toxicity: tremors and muscle weakness, increased appetite, hyperactivity, constipation. So lithium is the gold standard drug of choice for people with bipolar. It reduces the mania. So bipolar is manic depression. It used to be called manic depression because they had a mania phase and a depression phase. And lithium reduces the mania. So I want you to think about the name lithium. lithium, sodium, potassium, magnesium. Lithium, y'all, is an electrolyte. Another word for an electrolyte that we don't use hardly ever is the word mineral. So mineral, these are actually considered minerals. But if you see a question where it talks about minerals, look for an electrolyte level or electrolyte. Lithium is actually an electrolyte. The universal sign of any electrolyte imbalance is muscle weakness. I took care of a patient one time. Her family brought her in because they thought she was having a stroke, and it turned out she had a calcium imbalance, and we had to correct that. So it doesn't matter what electrolyte, muscle weakness is a universal sign of an electrolyte imbalance, and lithium is an electrolyte. So if we're looking at this and we go, muscle weakness is a universal sign, maybe it's muscle weakness. Increased appetite, that's not actually a sign of lithium. Toxicity, hyperactivity is not, constipation is not. So tremors and muscle weakness actually are the signs of lithium toxicity. Any neurologic sign other than some paresthesia, mild paresthesia in the fingers, when they start taking lithium, because it's an electrolyte, they could start to suffer some mild paresthesia in the fingers or at the tips of the fingers. But anything more than mild paresthesia, any neurologic disorder other than mild paresthesia, which tremors is a neurologic disorder, you should consider as potentially lithium toxicity. A nurse is reviewing lab results for a patient taking lithium for their bipolar disorder. Which lithium level would the nurse interpret as toxic? Now, I want you to notice this is the exact same question that I asked related to digoxin. So I'm going to go back to that question. A nurse is reviewing lab results for a patient on digoxin. Which digoxin level would the nurse interpret as toxic? A nurse is reviewing lab results for a patient taking lithium for their bipolar. Which lithium level would the nurse interpret as toxic? Y'all, I did this on purpose. Digoxin and lithium have the same toxicity level. Both have a toxicity level greater than 2. Now, lithium level, a normal lithium level is 0.6 to 1.2. Lithium level and creatinine level have the same normal values, 0.6 to 1.2. So lithium and creatinine have the same normal values. But lithium isn't considered toxic until it's over 2. So if they give you like 1.6 or 1.8, that's elevated, but it's not toxic, y'all. It's not toxic, okay? So it's not toxic until it's over 2. Digoxin and lithium have the same toxicity level. A patient with bipolar disorder is taking lithium. The nurse knows that maintaining a stable sodium level is important. Why? So think of this: sodium, lithium, sodium, lithium. They're both electrolytes. Sodium is the electrolyte that can seriously alter lithium levels. So think of it as sodium goes down, lithium goes up. As sodium goes up, lithium goes down. I'll say it again. As sodium goes down, lithium goes up. As sodium goes up, lithium goes down. Now, lithium has to stay at a certain level between 0.6 and 1.2. If it goes up too high, they become toxic. If it goes down too low, they can become manic, because remember, lithium is used to treat the mania. So if lithium level drops below 0.6, they can become manic. If it goes up too high, they can become toxic. Now, which sodium level is likely to increase lithium level? Remember, as sodium goes down, lithium goes up. So if sodium level goes down, they're more likely to become toxic. If sodium level goes up, they're more likely to become manic. All right, so knowing that, let's talk about this. Low sodium levels can increase lithium toxicity. That's true. High sodium levels can enhance the therapeutic effects of lithium. No, that's not true. Sodium levels do not affect lithium levels. That's not true. High sodium levels can increase lithium toxicity. That's wrong, because they go in the opposite direction. So the nurse knows that maintaining a stable sodium level is important because, so we're looking for the true statement. So A is the true statement. Question 7, a nurse is providing education to a patient starting lithium therapy. Which of the following statements should the nurse include about dietary sodium? So I put 2 questions on here related to sodium because I want to make sure you know it. And there's a good chance you could ask a question about this. So I wanted to make sure you know it. So which of the following statements should the nurse include about dietary sodium? You should avoid salt in your diet to prevent lithium toxicity. Well, if you avoid salt, your sodium level goes down and the probability for lithium toxicity goes up. So avoiding salt will not prevent lithium toxicity. So that's false. It is important to maintain a consistent intake of sodium to avoid fluctuations in lithium levels. That's true. That's a very good NCLEX answer. Increasing your sodium intake will help reduce side effects of lithium. No, because if you increase your sodium, you become more manic. You're going to reduce the level of lithium, and you're a little more likely to become manic. Sodium intake is not important. That's not true. So the only true statement is B. That's just a good NCLEX answer. Maintain a consistent diet, right? Maintain a consistent diet. That's a great NCLEX answer. If I was just purely guessing, that would be a great guess. I know it's the right answer, but if I was guessing, I would still have picked it because it's just a good NCLEX answer. 8, a patient with chronic asthma is taking theophylline. The nurse knows that which of the following symptoms indicate theophylline toxicity. So theophylline reduces bronchospasms because it relaxes some of the muscles in the lungs, so it reduces the probability for bronchospasms, which is why it's used with asthma. So the nurse knows that which of the following symptoms indicate theophylline toxicity. Now remember, these are facts you have to learn. So either you know it or you don't know it. There's some, I have like a whole series of SATA questions where I talk about how you can do good guessing. This is not a great option for guessing. Either you know it or you don't know it. So what are the signs and symptoms of theophylline toxicity? Nausea and vomiting, constipation, weight gain, tremors, hyporeflexia, tachycardia, and muscle weakness. Well, I know theophylline is not an EM. It's not lithium, sodium, potassium, magnesium. So muscle weakness doesn't seem like a good guess. And nausea and vomiting actually is a sign of toxicity both for digitalis and for lithium. You can see, I didn't tell you nausea and vomiting is a symptom of lithium toxicity, but nausea and vomiting is just a classic sign of toxicity for any drug, okay? So nausea and vomiting is a good guess. Now the other ones, just so you know, you just have to memorize it, y'all, tremors and tachycardia. So it can cause tremors and tachycardia. And if you were to think about guessing on this one, bronchial dilation is associated with the sympathetic nervous system. It's associated with the sympathetic nervous system. And the sympathetic nervous system causes heart rate to go up. And it can cause tremors. Like if you're in a fight or flight situation and your sympathetic nervous system is stimulated, you definitely have a lot of extra energy for running around and going to what you need to do. But if you have a sympathetic nervous system stimulation, let's say you're sitting in court waiting for them to tell you if you're guilty or not guilty for the murder of somebody, you've got a massive sympathetic stimulation going on. And do you know what's going to happen? You're going to start to tremor. You're going to be like shaking your legs. And you're like, okay, what's going to happen? What's going to happen? And you're tachycardic. You may start to feel a little nauseous. Okay, so these are if you just want to have a better way to remember it rather than just memorizing it, that would possibly be a helpful way to remember that these are the symptoms of theophylline toxicity. A nurse is reviewing lab results for a patient on theophylline therapy. Which theophylline level would the nurse interpret as potentially toxic? You just have to know it. It's greater than 20. So DIG is over 2, lithium is over 2, theophylline is over 20. All right, so you just have to know that. Either you know it or you don't, y'all. Hey, the Clinic Review is the very best NCLEX review in the entire universe. The Blue Book focuses on facts, but the Clinic Review focuses on testing strategies. It's one of the best, well, y'all, I think it's the best NCLEX review in the entire universe. And I strongly recommend it. You can go to Clinic Reviews to sign up for that. We also do tutoring, small group tutoring, not one-on-one tutoring. I do once a month. I do small group tutoring. You can sign up for that at clinicreviews.com. And I hope you have a great rest of your day. Thanks.